Let's talk about client identification. Right, client identification. This is very important for the NCLEX exam because before doing anything for the client, the first thing you need to do is to identify the client. Right. All your question will not really test you on this, but NCLEX have their way. They have their way of testing you on knowing if you know you need to identify client the right way, not only identifying client before a procedure, but the right way, because the most important thing is identifying client the right way. That is what NCLEX really focus on. NCLEX believe that okay, we for sure know we need to identify our clients, but do we know how to identify clients the right way? Right. So let's discuss how we identify clients. We have different form of identifier. I'm going to list them. One is the full name, right? The client full name. Another is the date of birth. We also have the medical record number. We also have photo ID. So these are the approved way of identifying clients. But this is 1, 2, 3, 4. So NCLEX, or in general, right? Nursing practice want us to use two form of identification. Two form of identification. So two form most commonly used is what? The name and what? The date of birth. So two form of identification: name and date of birth. You can use the name, MR number, the name, photo ID. It depends, but the commonly used one right here is the name and what? The date of birth. In as much the what you're using to identify the client is within this approved means of identification, then you are good. But we use what? Two form of identification. We don't just use the name only. We don't just use the date of birth only. We don't just use the MRR number only. We don't just use the photo ID only. So that is it. Now, the wrong way you should not be identifying clients. Let me tell you that now. Now, the wrong way you should not be identifying clients, most especially what NCLEX want to test you, is that you should not use what? Room number or bed number. You should not use room number or bed number. These ones, they are what? Red flag. Right. They are totally wrong. Right. We don't do that. They are not safe. Right. Also, just in case maybe NCLEX want to test you mainly on client identification, right? There are other information you also need to know. Just in case the NCLEX want to test you mainly on client identification, one is that you need to compare what the client is saying to what their ID band. Very important. You need to compare what the client is saying to what their ID band. That is one thing you need to know. You also want to make sure you double check the spelling of their name. Right. You want to make sure you double check the spelling of their name. Very important. Right. We have special cases. Right. We have special cases. Um, we have special cases. These are people that are non-verbal clients. Right. For non-verbal clients, uh, patient that they are unconscious, confused, sedated, or a child, they can fall under this special case. Right. For this kind of people, right, we can do this. This only apply to special case. If that question is not testing you on special case related to client identification, don't use this means of identification. Right. It only apply to special case. You want to what? Ask a legal guidance or caregiver that will help in identifying. We also want to use what? Their ID band, because they will have ID band, and want to confirm the ID band alongside with what? Their medical record. also want to like use barcode, right? Barcode scanning if available, right? If the NCLEX put that, then select it, right? These are for special case as a legal guidance or caregiver ID band, and you confirm alongside with the medical record, right? Barcode scanning if available. Now, one thing you need to know is about this barcode. Now, barcode does not replace checking the name and date of birth. Right. NCLEX might test you to see if you know that. NCLEX might tell you barcode replace checking the client name and date of birth. So that would be wrong if NCLEX say make a statement like that, because the barcode, right, the barcode does not replace that. The barcode does not replace you as a nurse checking the patient's name and what date of birth. It does not replace. NCLEX might just put it like it's correct. NCLEX might just say barcode replace checking patient name and date of birth. You know that answer is wrong, so don't select it, because it does not replace patient date of birth. Now, I always used to tell students, when you are reading NCLEX answer keys, right? NCLEX most of the time write your answer key to be 70 to 100% correct, in a sense that you are going to see a lot of correct information, but in between they might just add something, which is that 30% that make the whole answer key wrong. So you have to read. For I'm saying this because a lot of students are not patient with reading the question or the answer keys. When they just read like 2 3 words of the answer key and it look correct to them, automatically they feel that is the answer. That will cause you problem on the NCLEX exam. Most of the time you have the ability to pass the exam, but because you don't pay attention to the answer keys, you jump into conclusion real quick. Now look at this question. The nurse is preparing to administer a unit pack red blood cell to a client. Which of the following actions should the nurse take? Now look at number 4. Now look at what number 4 is saying. Number 4 is saying verify with another nurse. Obviously, we know this is correct. When we are preparing to administer blood transfusion, we want to verify with another nurse. Now, at this point, a lot of students are saying this is correct. But guess what? Look at what the NCLEX is saying, that the client room number is on both the blood product label and the client identification band. Remember, we compare what are they saying? We want to know what the patient name is and what their date of birth. We compare that with their verbal statement alongside with their ID band. You can see what the NCLEX put right here. So, and the two things we should never use is what? Room number and bed number. We should never use room number and bed number, never. But right here, guess what? See what the NCLEX is saying, that we should verify with another nurse using the room number alongside with the client identification band. And we definitely know this is why this answer is wrong, because of that room number. You can see how NCLEX work, right? So NCLEX put options like this most of the time because they want to see that you are a safe nurse, and this is how most of the time NCLEX see that you are a safe nurse. So please pay attention to your question all the time, right? So yes, in order to summarize what we have been saying so far so good, right? NCLEX is definitely going to test you on client identification, and then we have a lot of approved identifier, but commonly we use what? The patient name and date of birth. We should never use room or bed number. You should never use this. This is good. You should never use this. Now, for patients that fall under special case, we can ask a legal guidance or caregiver to identify them. We can use ID band and confirm alongside with their medical record number, and we can use barcode scanning if available. And note that barcode scanning don't replace checking the client name and what date of birth. Right. One thing you need to know is that another thing you need to know is that you want to double check spelling. Right. A patient name might be John B. Smith, and another patient might also be John A. Smith. So you understand, you want to make sure you cross check so that, right, that's what you definitely want to do. Right. um yeah, you want to make sure patient verbally state their name and you compare that with what their ID band. Right. So yes, this is everything you need to know about client identification. I'm going to see you in the next video.